Yeah, so thanks so much for joining us tonight. Again, really appreciate it. For those of you out there in social media land, if you're on CS Assist website or CS Assist Facebook page or SIP's Facebook page or UCDI Leadership's YouTube page, please feel free to share this video. Tonight, we're going to talk about cross-contamination, what it is, and if it's really that serious. And so without further ado, and to honor your time, we're going to get right into it. A lot of people have spoken about cross-contamination, and if you're at a grocery store, they teach you about cross-contamination. If you get a food handler's permit, they say some things about cross-contamination. But here with COVID-19, we have become aware even more so of how cross-contamination can affect different things. And so tonight our panelists are going to help us, and they're going to share some information and some insights as it relates to cross-contamination, what it is, the dangers of it, and ways that you can circumvent it. And so let's just go ahead and get started. Any one of the panelists, Ms. Cherry, Lila, Mr. Perkins, is there anything you guys would like to share? How about you, Lila? You'd like to share about cross-contamination?
What I see more often than anything is just to kind of I think the media put out a lot of information about what you need to do to protect yourself, but didn't really give people the proper information about the hygiene that goes into PPE and what we need to do to kind of keep ourselves safe. Right. So you see a lot of I know I do in my community. You see gloves discarded on the ground. You see people in the grocery store with their gloves on, touching everything and never disposing of those gloves, never removing them, but they've touched everything from the produce to the meat to the boxes of cereal. And for me, I get horrified. I'm like, oh my God, it's like a nightmare going to the grocery store now. I don't enjoy it at all. I immediately panic because I see people doing things that I know are just not safe. And then I'll see them go grab their phone or pull out their debit card or do something and put that item right back in their pocket or put their phone to their face. And I immediately start thinking about, you've just allowed all that bacteria you were trying to avoid with those gloves on. You just put it back right on your body. And so that's cross-contamination. I think that people don't even understand exactly the things that we do to protect ourselves and keep ourselves safe are also some of the things that are making other people unsafe. And I think that's one of those misconceptions and myths going on right now.
That's a very good point. So using the gloves actually gives you the sense of security and the sense of safeness. Mm-hmm. But in doing so, you're actually endangering others because we're bringing things from one thing to the next. And it's probably unconscious, or sometimes you just are not aware, or you just don't know. How about you, Ms. Sherry?
And I agree with what Lila said, because now, I've been more conscientious when I go around anyone. And so my hands are so raw. I've never washed my hands as much as I've been washing my hands now. So they say, like the gloves gives us a false sense of security because we feel like, well, my hands are protected. But like Lila said, we're touching one thing and touching another. And so I just say, even if you have to have a couple of pair of gloves when you go into the grocery store, and be conscientious of how we take the gloves off, because we still don't want to touch our hands. It's like working in sterile processing for over 35 years. I was always taught that every case, you consider that case, every case is contaminated, but it was like when different, like HIV and all that, then it was the special treatment. So my thought process is on that, everything is that special treatment case, that when we're touching something, if we're in doubt, like we were always taught, if we thought we had a hole in our gloves, take those gloves off and just, wipe down your door handles, everything. You don't know who touched your car when you get ready to get in your car. And I don't want to live in a world, just a world of conscientiousness. So that's my thought on that.
All right. How about you, Mr. Perkins?
Well, we know, being healthcare professionals, we're trained to use universal measures, universal precautions. Mm-hmm. So in a hospital, when you give a trained professional a set of PPE, gloves, masks, etc., we're also trained to use engineering controls, right? One-way workflow. So telling the public to use gloves, there's a certain training mechanism that goes along with that process. Or put on a mask, there's a training process that goes along with how to properly don and draw off a mask, take on and take off. So it is more than just giving someone gloves, giving someone a mask. If you see on the net, what's also being made national headline news is we had to relearn how to wash our hands. Right. So something as basic as hand washing, we should be more conscious and conscientious on, can the public, do they know how to wear masks properly? Do they know how to put on and take off gloves effectively? So it's more to it than just putting on gloves and a mask. We have to get back to the basics of infection prevention, infection control.
Yes.
Yeah. Wow. You know, and those are the things many people don't think about. You all are healthcare professionals and you work within the sterilization field. So some of these things may be old hat to you, or it may be like muscle memory, things you do almost unconsciously, like you don't have to remind yourself to do it. And so even when you were saying about how to take it on and take it off, I did think about touching everything because we were doing this show, but the reality is how to take it on and take it off. And so that's why we have the professionals on here, not just for the individuals who are in our field, you know, because there's a lot of misinformation out there. And so we want to bring the latest information to our field, to people who are working and doing it there, but also for the public, because they're not going to have 30 plus years in sterile processing. You know, they're not going to have the expertise that you all bring. And something as simple as knowing how to take off gloves, you never think about that. You just take them off. You just take them off. And who knows how it will undermine the effect of what you've been doing. Man, that's really good. That made me think a little bit. Hey, so what we're going to do right now, we're going to take about 30 seconds to a minute, and actually going to a couple of companies sponsor this so that we can get the information out, not just to the sterilization field and those who are working. SPD, some of our invisible frontline individuals are the people who are less visible, because we're never invisible, but the less visible people and people who you don't know are working diligently for your safety. But these two companies have sponsored this to be sure that those individuals have an outlet, a place to ask questions, something within their field, and that the general public can get some information and trust that you subject matter experts can make it plain for people. So we're going to take about, like I said, about maybe up to a minute, and we're just going to give them some due diligence there, and then we'll be right back and talk a little bit more about cross-contamination.
Okay.
Lost time is never found again. CS Assist specializes in providing CS leadership more time to focus all resources on patient care safety by assisting with all of your compliance needs for survey readiness preparation. We understand that there are many department recommendations and even more regulatory compliance mandates to adhere to and to follow. We focus on the constant changes in staff education needs and regulatory compliance mandates, allowing you to focus on daily operational needs. In realizing the value of time, we want to partner with you to alleviate risk. We offer a variety of support packages that will assist you with everything from your CSPD department-specific policies and procedures to a fully customized survey readiness plan for your department. For more information regarding our consulting retainer options, our qualitative reporting tools, and online documentation, please give us a call at 1-833-CSP-ASST. The number is 1-833-277-2778. We look forward to speaking with you.
Awesome. Thanks so much. Hey guys, we're back with Knowledge or Nonsense. This is just something to help us navigate the COVID experience as it relates to some of the reprocessing things that they're asking us to skirt, some regulations they're asking us to skirt, some best practices that they're saying, well, maybe not this week, just because this is an unprecedented time. And so we have with us Lila Price, a dynamic educator that hails from Philadelphia. Some of you are familiar. She was with us last night, giving us some real key information and some key takeaways. She is a CRCST, a CER, and a CHL, and she has devoted many years just to growing and learning this field and educating others about the field. We have Ms. Karen Cherry. She's president of SIPS Consults. She has over 30 years in the sterilization world, different things from cross-contamination to knowing what temperatures, things that really don't kill bugs that people may think, knowing the difference between what's clean and what's sterile. And so she's going to bring her wealth of knowledge to us. She's an MBA, a CRCST, and a CER as well. I believe she's known by name in the sterilization field. So she's a highly sought after source of expertise. We have Mr. Lorraine Perkins. He is the president of surgical services with CS Assist. And Lorraine has just been so dynamic in helping get this out, because it's like, hey, we have to be sure that we're taking care. We're about patient safety, but we have to be sure that we're taking care of the people too. Like, what are we doing? Why are we doing it? And just really about bringing options and innovative ways that we can sterilize things and try to minimize, not casualties, but minimize the hits we don't have to take in the sterilization thing, keeping our workers healthy, keeping them safe, and helping them be confident that they don't have to take something back to their families. And so again, with the cross-contamination, I wanted to ask you guys, you can weigh in for the sterilization field, but if we could just take a couple of seconds for the general public that may be watching, I wanted to ask if you could share 1 to 2 tips, and just keep it like 1 to 2 minutes of ways that they can minimize cross-contamination, whether it's the house, the car, the gas station, wherever it is.
Okay, I think it's like Wayne said, as far as being conscientious of your flow process, kind of look at the layout of whatever whether it's your car, whether it's your house, your kitchen, and just make sure that you aren't, first of all, wash your hands every day when you get up before you would go in there. And then just make sure that you're wiping down and you're not coming in from outside, because even if you go outside and get your mail, you can't be sure that the mail carrier had gloves on. We hope so, but just taking those steps. If packages come, leave them outside, as they say, for a day or so. Even though something's inside that box, that outer box has been touched. So those will be my tips. So my minute, I'm gonna get on off, but just be conscientious of, just because, don't take anything for granted that somebody else washed their hands when you're bringing something into your house. Okay, Mr. Perkins.
Well, I think for common knowledge, what we call common sense in healthcare on sterile processing, we use this term sterile consciousness. And what that implies is, if you think it's dirty, it is dirty. But we also have to go back to some of the basic stuff that our parents and grandparents taught us. Before you come in the house, take your shoes off. Leave the outside clothes outside. This is the opportune time to have a heightened awareness about surroundings and environment. Don't take corners short. Don't pretend that we're not in the high risk era, and follow professionals. There's a lot of good information from scientists being put on national airwaves that we can rely on. So trust the professionals, follow the science. Numbers don't lie, but be conscious of your surroundings. Sterile consciousness.
Okay.
I like that. To piggyback off of that, of both Karen and Luane, I just want to add in that we have to be aware of that this virus can live on surfaces for long extended periods of time, hours, days, and that's something very hard to fight. That's why we are kind of behind it and losing in this battle, because it's just something that you can't prepare for. You just don't know where it is, how long it's been there. And so that's that cross-contamination piece. I touched that doorknob and someone else touched that doorknob, and now I, wipe my face or try to get something out of my eye, and now I'm exposed to this virus. But I think you hit it right on the head with, washing your hands, being conscious of leaving packages outside, leaving your shoes off. Like, that started immediately in my house. Like, everybody, look, pay attention to what you're doing. Wash your hands, come in. When you touch something, wipe everything down. I'm wiping off everything in my house, every single item that's being touched, because I have young children, and I also have, things that come in and out. I'm exposed to things when I go out to work, and I'm in the healthcare system, so I don't want to bring anything back to my family. The same rules apply. I leave those street clothes at, I put on my scrubs and I leave those street clothes when I come in the door, at the door, take a shower and prepare for things. But something I just wanted to bring up that I haven't heard, I haven't heard much people talk about. And it's just the fact that we have to be conscious of the full package of hand hygiene and just in general, washing your body and in addition to everything else that you touch. When I go outside, I cover up I'm not only wearing a mask, but I'm also covering up my hair. Keeping those things covered, the clothes that I wear, all of that stuff stays at the porch, and I come in and then I assess and change and shower and do things because I just don't want to leave those things laying around. And right. Because I know that this virus lives on surfaces for long extended periods of time. So I would caution people just to, rethink the way you handle everything and be cautious of what you're doing and your family, because everyone that comes into your household is exposing you to what they've been outside and touching and dealing with all day.
That's right.
All right. Well, it is time for us to get into our hot seat question. And it is going to be amongst the cross-contamination. As you guys were talking, I was thinking about an associate of mine who, toward the beginning of this, I was like, hey, listen, do the social distancing. We don't know what's going on yet. People are guessing at best. They're making educated guesses, but it's guessing at best. And I remember my associate was like, well, it's only a few people. We're only having a few people over. They had like a sleepover. And because I've been around sterilization at this point in my life, I was like, no. But you don't want people just to live in fear because of your body of knowledge. So I implored as much as I could. There was grace there, and no one is tested positive. So for the hot topic question, prior to you answering the hot topic question, I'm going to give you another minute. I'm going to, pay another sponsor. But for our hot topic question, we're going to talk about different things because you mentioned hair and about the fact that these droplets, this virus can live on things. And so I want us to hit some different things. If we know it, if you can say, plastic, metal, hard surfaces, like even the doorknobs, because you don't want people to live in fear, but you want them to be informed. So we're going to take about a minute, and then we're going to come back, and I'm going to ask you guys, hot seat. You have 30 seconds to a minute to let people know how long things stay on certain surfaces. And if the person before you hits it, you have to hit other surfaces. Yes, clothing. Get ready.
At SIPS Consult, we understand that these are changing times, and these are times for unity. SIPS Consult would like to extend complimentary sterile processing, consulting, and educational services to support your sterile processing department needs during this COVID-19 crisis. Everyone is aware that things are extremely challenging right now. We want to personally thank you for caring for our communities. We appreciate you. We appreciate you being in this fight for us and with us and remaining on the front lines. In an effort to provide SPD support during this time, we have created a non-automated 24/7 complimentary helpline with subject matter experts to support your department. We encourage you to call us with any sterile processing questions or inquiries. To speak with one of our dedicated consultants, please call us at the number below.
All right, so thanks so much to SIPS Consult and CS Assist for sponsoring this. Again, last week, it was a lot of things with essentials being treated as if they were expendable. And it was like, who's our voice? Like, where's a place that we can go to get these answers? I know we're looking to a lot of the structures, but again, this is unprecedented for them. So what are the professionals saying? What are other members within the sterilization field saying about just really about the virus, about how to reprocess things? Tomorrow night, we're going to be going in depth on how to reprocess the N95 mask. And we're also going to try to come up with a couple of tactics, a couple of strategies for people who are not in sterilization world, and letting them know maybe a couple of things to make sure their things are being disinfected at home. But as for right now, we've heard that this virus can stay on things for days. We've heard all of that. So subject matter experts, let's talk. how long can the virus remain on certain surfaces? Like, how long can any virus, remain on certain surfaces?
Well, I'll start. One, I always like to play on words, right? So pathogen, I need folks to Google the term pathogen, right? And the origin of that word. Pathogen is a Greek word, and it comes from the origin born of disease. And these diseases or pathogens can travel. Some can travel in cellular form. Some are the world's best hitchhikers. But to answer your question again, I know that the COVID pathogen or virus can live on surfaces like metal and doorknobs for up to 5 days. And that's according to the CDC. So Google the term pathogen, Google the origin of the word, and also Google some of the world's best hitchhikers, and you'll get a long running list of these different diseases that can impact your day-to-day livelihood and well-being.
Okay.
So this person still does her research because I get a lot of that. It's unknown, and what some of the things what Dwayne said as far as the amount of days, but what I get even where it varies up to 19 days on certain surfaces. So
yeah.
Miss Cherry seems to have frozen. Lila, how about you?
I know that I've heard it can stay on cardboard boxes for 3 to 5 days. So that the packages you receive from your Amazon, your delivery service. So just being cautious. Like I leave those packages out on the porch for a couple days, or put them in a separate area, and then wait until we get around to opening them, and then I discard those boxes and put them out. I don't think it's any different than what we, kind of get into the habit of and work in sterile processing. We don't let any correlated boxes into our department area. So I kind of have adopted those same practices and principles that I've learned over the years of working in sterile processing. I think that's one of the good ones that I remember. Disinfecting everything, but also cleaning everything. So, we can clean a surface and wipe it down with regular soap and water, but then if you don't add any type of disinfectant, you're not really protecting it from allowing that bacteria to continue to spread. So keeping that in mind is just another form of cross-contamination, but also that myth of thinking that because we wiped it down, maybe with a quick little wipe, but the wipe didn't have any type of disinfectant, we're not really getting rid of or killing off the actual virus.
That's a very valid point, Lala. I remember growing up, my mother would send me to the store to buy some, Lysol. And because I wanted to keep the change, I wouldn't get the Lysol. I would get the stuff in the bright purple bottle that smelled good. Now you take that stuff back. Yeah, it made suds. It lathered up pretty good, but it was killing nothing, right? So that's one of the benefits for being in the healthcare profession in our area of SPD. We know the difference between clean and dirty and the different levels of disinfectants. So very good point. You were able to learn a lot from our workplaces.
So one of my colleagues, I think she was trying to help me out. She sent me something saying plastic 2 to 3 days. So I don't know. I don't know if I missed someone saying plastic. So I'm gonna give Wendy a kudos. Thank you, Wendy.
We do thank Wendy. She did put it in the chats as well. She said plastics for 2 to 3 days. Copper is, I believe she said 4 hours for copper. Let me make sure. Yeah, copper is 4 hours. Wendy is a subject matter expert as well. And so I just want to thank her for putting that out there. Listen, if there's some hot seat questions you want to submit, you can submit them in the chat box, or you can send an email to info@UCDI Leadership. Listen, if you're in the sterile processing world and you're seeing some practices that give you pause and you're kind of confused because you don't want to be disrespectful to your leadership, but you also know that that's not the right way, maybe there's a medium, maybe there's a place you can meet in the middle. Send us your questions at info@UCDI Leadership. Join us. Like I said, tomorrow night, we're talking about reprocessing those N95 masks. Wendy also mentioned that outside of a surgical mask, it can last for 7 days with exclamation points. I actually want to share that with you all so you'll be able to see it. So listen, this is not to instill fear. This is to give you the tools that you need to be wise, both in the sterilization field and in the general public. We are 23 minutes in. We're going to get this thing down to about 15 minutes because we want to give you the information. We don't want to over-inform you, but we want to let you know ways that you can take ownership and have a part in keeping your area sterile, keeping your area safe. You can know this information and you can share it with both your coworkers, your colleagues, and your family. So I'd like to thank Karen Cherry, LaWayne Perkins, and Lila Price, subject matter experts within the sterilization and reprocessing field. I want to give a huge shout out to CS Assist and to SIPS Consults for just setting this up and allowing us to have this platform to speak and to have our questions answered. Again, if you have any more questions, please let us know. Send that email to info@ucdileadership.com. We will be right here at this same place tomorrow on CS Assist Facebook page, SIPS Facebook page, and UCDI Leadership's YouTube page. Thank you guys so much. Thank you so much. You guys are awesome. And everyone have a very nice night. Be safe.
Stay safe.
Yes, stay safe.
Bye, everybody.
Good night.